My name is Konstantinos Lazaridis. I'm a consultant and a professor of medicine in the Division of Gastroenterology and Hepatology at the Mayo Clinic. The title of this article is The Cholangiopathies, and it will appear as a review article in the Mayo Clinic Proceedings. My clinical and research interests focus on the diagnosis and therapy of the cholangiopathies, particularly primary biliary cirrhosis, primary sclerosing cholangitis, and cholangiocarcinoma. The cholangiopathies are a group of chronic liver diseases that lead to destruction of the bile ducts and cause significant morbidity and mortality. Indeed, approximately 15% of all transplants performed in the United States during the last 30 years were because of the cholangiopathies. Therefore, although those are not common diseases, they contribute to a significant portion of the liver transplant population in the United States, and therefore they have an economic burden on the patient, their family, and the society. So in this review, we offer a concise summary on the biology of the cholangiocytes. Those are the cells that line the bile ducts inside the liver, and they represent a target of the cholangiopathies. We describe also a conceptual framework about the diagnosis and therapy of those diseases, as well as how our understanding of these processes help us to define novel therapies for the cholangiopathies. In this review, we also present recent progress made about the cholangiopathies. The progress made in a sense to understand what causes the diseases, what's the pathogenesis, and as well as how this knowledge influences us to better diagnose earlier and treat our patients. For clinicians, it is extremely important to understand that patients with cholangiopathies many times have no significant symptoms. And therefore, if someone has elevated liver tests and a physician cannot identify the usual suspects of liver disease, then someone has to think about the possibility of cholangiopathy. It's important also to know that early diagnosis of a cholangiopathy leads to a better outcome because we can follow up those patients, we can treat some of those more effectively, and thus early diagnosis can make a difference. We have spent several decades in this institution to study the cholangiopathies. Work of many have led to significant ways to earlier diagnose and better treat cholangiopathies. We still do so. We have a lot of pride on our work and several research projects that are ongoing for early diagnosis of the disease, understanding the genetic predisposition of cholangiopathieS, as well as to better treat those patients. And therefore, we are available to other physicians or investigators who would like to refer these patients to us or would like to collaborate with us on the cholangiopathies. We believe cholangiopathies pose significant challenges for clinical management, for therapy, and therefore we think that this review provides a good background to better understand what cholangiopathies are all about, what is the current knowledge about their causes, where the existing and future therapies exist, and we are excited to be part of this work. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.